The state of Texas estimates that 12 to 14 million people will be eligible to get a vaccine starting next week. That's when Texans ages 50 and up can get in line.
But we learned that since vaccine supply is still limited, DSHS says they expect providers to keep prioritizing people in 1A and 1B in the weeks and months ahead. KXAN's Tahira Rahman reports different providers in the Austin area will take different approaches.
It tripped my trigger.
Russ Podest wasn't happy when he learned that the state would allow 50 to 64-year-olds to get vaccinated starting Monday. The 69-year-old and his wife have been waiting for their turn for about a month.
If you have more people coming in Group 1C, it's going to become even more and more difficult for us to get an appointment.
A spokesperson for the vaccination site at the Circuit of the Americas says they'll be adding 1C appointments right away for their patients. It'll be the same for Austin Public Health. That means when the next round of appointments are released on Monday, a 65-year-old won't necessarily be prioritized over someone who is 55.
We ought to get Groups 1A and 1B fulfilled before we start adding more people to the mix.
That is the approach Williamson County plans to take. They don't expect to send vaccine appointments to folks in 1C for another couple weeks.
Priority, in my mind, should still be trying to get to those that are highest risk first.
Dr. Manish Naik says Austin Regional Clinic will also try to get their 1A and 1B patients first. But narrowing down a timeline is tricky because people are often on multiple waiting lists.
People are doing what we've told them, but it makes it a little harder then to track who's gotten it and who's not gotten it.
One thing that would speed up the process, more supply.
Which presumably is coming, but we're still waiting on it.
Tahira Rahman, KXAN News.
Texas expects more than 800,000 first doses next week. That's about 200,000 fewer than it got this week. Vaccine hubs will get the same amount of shots, but there are fewer shipments to smaller providers. And DSHS says there won't be as many doses of the one-shot Johnson & Johnson vaccine for the next 2 weeks while production ramps up.